Okay, so this is the Restraints Mastery. So to begin, we're gonna start off doing quality of life. So I'm gonna, hi Chantel, my name is Judy. I'm gonna be your student nurse today. So the doctor actually ordered us to put on some restraints for you. So I'm gonna be doing that today. I will be handling you gently and protecting your rights during today's procedure. So I'm gonna start by screening you, by protecting your privacy. And then I am going to practice hand hygiene. Okay, and then can I see your wristband just a second? Okay, could you verify your date of birth and full name for me? Okay, awesome. Let me check my care plan. So I checked my care plan. I see that does match. So now we can begin, and we are going to start by collecting the correct type and size of restraints. So for Chantel, I would probably need a restraint that is a little smaller for the wrist. I would need padding for her bony areas, and then bed rail protectors if they are needed. So I will get my restraints. So for the purpose of today's video, this is my padding for the bony area, and then this is my restraint for the wrist. Okay, so I had already done hand hygiene, and I looked at her bracelet just to see who she said she was. So now I'm going to raise the bed to a good height for good body mechanics, which would be just about to my waist. Since we don't have an actual bed right now, we have a chair. We're just gonna work with the height that we've got. But with the bed, I would raise that about to my midline. Okay, so now we're gonna start off with procedure. So I'm gonna make sure my patient is comfortable and in good alignment. So it looks like Chantel's in pretty good alignment here. And Chantel, are you comfortable?
Yeah.
Okay. So now what we're gonna do is, if we had the bed rail protectors, we would set them up. And then I'm going to pad the bony area. So I'm gonna take my pad here, and I'm gonna place it here. Just kind of wrap that around a little bit, like it's secured there. Okay, and so now I'm gonna get the wrist restraint. So if this was a actual wrist restraint, I would put the soft part toward the skin, on top of the skin, so there wouldn't be any rubbing or anything like that. So here's my restraint. I'm gonna go ahead and just apply that. So here my restraint is applied. I'm gonna check for snugness, okay? I'm gonna make sure I can fit 2 fingers underneath. If it's too tight, then I will have to adjust, and if it's too loose, I will have to adjust as well. So again, I just make sure I can fit 2 fingers underneath, and then I will check for snugness again. And so now I'm gonna tie the restraint to the movable part of the bed. So the movable part of the bed, let me move the phone so we can get everything. So the movable part of the bed will be this rail right here for the purpose of today's video. Okay, so I would make sure it's tied at the rail. And usually beds will have a little hoop where you can put the restraint in. We don't have a hoop, so we are going to pretend like we do. So I'm gonna make a U, I'm gonna cross over, pull my loop through it, and I'm just gonna do a little slip knot here, okay? Making sure they're, okay, never mind. I will be doing a slip knot. Okay. And I would make sure that there is about 1 to 2 inches of slack, so that my patient could still move, but not enough to injure herself. Okay, so now that Chantel's wrist restraint is on the bed snugly, I would repeat these steps for the other wrist as well, doing the bony padding and tying the restraint with a slip knot to the part of the movable part of the bed, excuse me. So now what we're going to do is we are going to do post-procedure. So I'm going to position Chantel in the way that the care plan states. So we will pretend she is in her bed, and I would lower the bed all the way to the ground. And I would put her head up, anything that she needs to make herself feel more comfortable, and then also following the care plan as well. So now I'm going to provide for comfort. So Chantel, is there anything that I can get you to make you more comfortable today? Okay. I'm going to take her signal light, and I would actually place it in her hand so that she would be able to call me if need be. Now I'm going to do hand hygiene again, decontaminate my hands. Okay, and then I would go report and record my observations. Okay, and then I would do my follow-up 15 minutes later, so it's been 15 minutes. I would check the pulse, the color, and temperature of the restrained parts. So I would go ahead and check the pulse. Her skin isn't red or anything like that. It looks pretty normal. And so then every 2 hours I would do these things. So I would go ahead and remove / release the restraint. So I'm gonna bring the phone over here again. And so when I go ahead and release the restraint, what I'm gonna do is I'm gonna pull, and you should see that that knot comes completely out. So then I would go ahead and I would check Chantel's vital signs, reposition her just to make her more comfortable, and also to prevent pressure ulcers or anything like that. And then I would provide food, fluid, hygiene, or elimination, see if she needs to go to the restroom or anything like that. And then also skincare. So maybe the area with the restraint on it is rubbing, or she has some sweat there and she wants me to dry that. That would all be skincare. And then we could do some basic range of motion exercises. So I could just, work her wrist. I could exercise her wrist with those range of motion exercises, just to make sure there's still some mobility there. And then I would go ahead and reapply the restraints. I'm not going to in the video, but that's what I would do in a clinical setting. So then I'm gonna go ahead and I'm gonna conduct a safety check of the room, just make sure that there's nothing that Chantel could possibly trip over if she has to get up. And then I'm gonna, again, decontaminate my hands. And then I'm going to document my observations.